Assalamualaikum and hi everyone. My name is Aina Fatiha binti Muhammad Tamizi and I am member of 5 is this group. For my part, I will be present the treatment, support strategies, recovery process and conclusion of Broca's and Wernicke's aphasia. As we have learned from the previous presenters, aphasia is a language disorder caused by damage to specific areas of the brain. In this session, I will explain how aphasia is diagnosed, the treatment available, the importance of family support, and how recovery can be improved through therapy and technology. Before aphasia can be treated, it must first be diagnosed correctly. Diagnosing aphasia involves several important steps. First, healthcare professionals review the patient medical history. They gather information about the patient background, previous health condition, and when communication difficulties first appears. Second, patient undergo language tests. These tests evaluate key communication skills such as speaking, listening, reading, and writing. The goal is to identify which language abilities have been affected. Third, doctor may use brain imaging techniques such as CT scan or MRI scans. This tool help locate the area of brain damage and determine the extent of the injury. Finally, specialists identify the specific type of aphasia such as Broca's aphasia or Wernicke's aphasia. This is important because different type of aphasia require different treatment approach. Okay, next, once aphasia has been diagnosed, the primary treatment is speech and language therapy. Speech and language therapy focus on rebuilding communication skill through targeted exercise. These exercises are personalized according to each patient needs because aphasia affect individuals differently. Therapy may focus on listening comprehension, helping patient better understand spoken language. It can also improve speaking and articulation, allowing patient to express words more clearly and retrieve vocabulary more easily. In addition, therapy support reading process, helping patient regain the ability to understand written text. Another important area is writing skill, which help patients communicate their thought through written language. Overall, speech and language therapy act like a gym for the brain. Strength communication abilities through regular practice and rehabilitation. Okay, next, recovery from aphasia does not depend only on healthcare professional. Family members or caregiver also play a vital role. One important strategy is to give patient extra time to process information and respond. Rushing or interrupting them can create frustration and make communication more difficult. Another strategy is to keep communication simple, using short, clear, and direct sentences help reduce cognitive overload and make conversation easier to understand. Family can also use multimodal cues such as gesture, facial expression, picture, or written notes. This additional communication method support understanding when spoken language becomes challenging. A supportive home environment can significantly improve patient confidence and communication progress. Technology can also help individuals with aphasia communicate more effectively. One example is communication apps. These applications use picture, symbol, and words to help users express their needs and feelings. Another helpful tool is speech generating device. This device produce spoken message when users select word or phrase, allowing them to communicate more independently. In addition, online therapy programs provide opportunities for continuous practice outside the clinic. Patients can access exercise and learning activity from home, making therapy more accessible and convenient. Although recovery rates differ among individuals, assistive technology can bridge communication gaps and support long-term rehabilitation. To conclude, aphasia is a language disorder that affects communication abilities due to brain damage. As we discussed earlier, Broca's aphasia is characterized by slow and non-fluent speech, while comprehension is usually prevalent. In contrast, Wernicke's aphasia involves fluent but often meaningless speech, along with difficulties understanding language. Successful recovery depends on several key factors: early diagnosis and treatment, strong family support, and professional speech and language therapies all work together on improved communication outcome. Also, aphasia presents significant challenge. Meaningful communication is still possible with the right support, intervention, and determination. So I think that's all from me and my group mate. Thank you for your attention. We hope this presentation was help you gain a better understanding of Broca's and Wernicke's aphasia. Assalamualaikum and bye-bye.